Good afternoon. I'm Jen Holtz, Associate State Director for Outreach at AARP Maryland. We are continuing our efforts to support all caregivers of children during the pandemic by streaming our Lunch and Learn interviews. We aim to provide you with great ideas, tips, tools, and resources for distance learning and helping kids thrive during this unpredictable and sometimes scary time. With the holidays upon us, many of us are approaching them with joy in our hearts, but we know that for some, the inability to celebrate traditions with loved ones will be really difficult for children and adults alike. When we first began reaching out to caregivers of children, we launched a series of teletown halls in which our regular guest was Dr. Jennifer Goetz. She provided us excellent information on addressing our children's mental well-being during the pandemic. We are thrilled to have her back today for a quick Lunch and Learn chat. Jennifer Goetz is a child and adolescent psychiatrist and assistant professor of psychiatry and behavioral sciences at Johns Hopkins School of Medicine. She works with children, teens, and adults on a wide variety of emotional and behavioral difficulties, with specific expertise in the treatment of individuals with eating disorders. Dr. Goetz, thank you so much for joining us today.
I'm so excited to be back with you guys. Thank you for having me.
Great. Mental health is a really heavy issue and it's more important than ever. So as we near the end of this long year, what effects have we seen on our kids' mental health? And what are some best practices that you're recommending to parents and caregivers to help their kids stay resilient?
So first of all, I want to say that I think we've seen from both adults and children alike an incredible amount of resiliency throughout this last year, which has been sort of unprecedented in terms of the effects that it's had in disrupting all of our lives. And I think for the most part, children and adults alike have been incredibly resilient in adapting to new and difficult situations and this quote, new normal, which hopefully won't be the new normal for too much longer with the vaccine on the way. I work in an inpatient psychiatric setting, and so we've certainly seen a steady stream of kids, teens, and adults who are really, really struggling with social and emotional issues right now. And it really crosses sort of into all domains. So a lot of difficulties in kids with depression. Many kids, because of the pandemic and having parents at home, are experiencing emotional trauma and some physical trauma as well. So we're seeing some of that. But most of what we're seeing is kids sort of reaching their breaking point when it comes to their sense of stability and structure being disrupted, and their sort of limitations around socialization. You know, kids and teens are developing and their social skills are just as important, if not more important, than their sort of academic achievements. And so the isolation that this pandemic has caused is really wreaking havoc on kids' mental health, adults as well. And so we're definitely seeing the effects of that in the outpatient settings and all of the inpatient settings as well. Jen, you are on mute.
Yep, sorry about that. Thanks for that catch. So yeah, how do we encourage our kids to stay positive and stay happy during the holidays while celebrating with friends and family is going to be strictly limited this year?
It's a really great question. So I think now is actually a time to start to make new traditions with families. So many long-standing traditions and getting together with extended family and friends may be on hold this year because of the pandemic, because of various restrictions. And so now is actually a great time to sit down with your family, whatever that looks like, at home, and talk about making some new traditions, whether that's cooking breakfast together on Christmas morning or Christmas Eve when that's not normally something you would do, or baking cookies together, or decorating the tree in new and different ways, or making ornaments together, whatever it looks like for your family, having Hanukkah party with your nuclear family and spinning the dreidel together when it might not otherwise be something you would have done. Even though old traditions might not be able to happen this year in the same way, we can create new traditions together that can then become incorporated into sort of ongoing family gatherings. And then the other thing is that, one of the one of the things that's come out of this pandemic is the sort of wider use of social technology, so Zoom and FaceTime and things like that. And so even though we might not be able to be together with the same people that we ordinarily would, we can still have virtual meetings. So you can still see some of the same family members and friends that you would in person, but virtually. And I would encourage families to do that whenever possible, to kind of maintain social connection and sense of togetherness.
Sure, absolutely. So important to use those traditions, even the new ones, to create a sense of normalcy for our kids. Absolutely. And thanks for your patience as I toggle back and forth between mute. I have a snowplow and a dog who's very unhappy about it going by there. So we're gonna trudge through. So next, as we see COVID numbers continue to rise, what advice do you have for the community on keeping our families safe? And is there any new information out there about how the virus is affecting children?
Yeah, it's a great question. So the things that we can do to keep our families and our friends safe are the same things that we've been talking about for months now. And they're really the simplest, least fancy interventions. So wearing a mask when you're outside, in any sort of space where there are other people around who don't live in your home environment. So always wearing a mask, staying 6 feet apart whenever possible, including outside, and washing your hands frequently, certainly after you sort of get them dirty, but also more frequently than you like otherwise normally would. Those 3 interventions are currently the best agents we have to fight this virus. As you know, and probably many listening know, the FDA provided emergency use authorization for the Pfizer vaccine, which is proven to be 95% effective in providing protection against the virus, at least in the early phase. And it started its distribution this week, which is really, really exciting. But I think the rollout and the time it's going to take to get large enough segments of the population vaccinated for it to be an effective tool in fighting this virus is going to take time. And it's equally as important now as it was last week and 8 months ago to be wearing masks, socially distancing, and washing our hands frequently. Those are still remain the best tools, including for anyone who does get the vaccine at this early stage.
That's great advice. Thank you for the information on how we can stay vigilant. To end our interview on an upbeat note, can you share an experience with us that you've had in your practice this year that has made you smile?
Oh my gosh. I feel like I smile every day at work. I actually feel like even in the pandemic, I have the best job in the world. I work with kids and teens and adults who are often in crisis on our inpatient units. And so I don't tend to see people at their very best moments. But one of the really amazing things about my job is I get to see them through to discharge, and the changes that my patients make in the time that they're with us on the different units that I work on is so incredible and warms my heart. So I discharged a patient this morning who hated being in the hospital, and today was able to talk about all the ways that her time with us has actually shaped and changed her, and kind of the things she's going to take forward with her. And those are really heartwarming moments because it makes what I do so worthwhile. But I smile every day, even on the really tough days. I think we have to.
Absolutely. Really speaks to the resiliency of the human spirit. So that's great.
It's so good.
Thank you so much, Dr. Goetz.
Oh, you're so welcome. It's been a pleasure to be here. I'm so thrilled you guys invited me back.
Absolutely. Absolutely. This has been so informative. We can't thank you enough for joining AARP Maryland again as we continue these efforts to help parents and grandparents and caregivers do everything they possibly can to support their children. So thank you again, folks, for tuning in, and please keep tuning in every other Wednesday for these great tips and tools for navigating COVID-19 with our kids. We'll see you after the new year.